My name is Mikael Ali. I'm a 20-year veteran with San Francisco Police Department. I've had a varied experience in the department, working uniform patrol, working investigations. I was the lieutenant in charge of our child abuse and exploitation unit. I worked 5 years in our gang unit. I've done an awful lot in the department in the time that I've been here. I was put in charge of the Crisis Intervention Team in September of 2011. And at that time, there was a crisis intervention partnership that consisted of a multitude of entities, including Veterans Affairs, NAMI, the Mental Health Association of San Francisco, the Public Defender's Office, San Francisco General Psychiatric Emergency Services, and a slew of other individuals who simply wanted to see a difference in how our department responded to individuals in crisis. I offer to you that this is not just an issue about mental illness. This is about people who are in crisis. This is about people who, for whatever reason, are in conflict with members of society, and law enforcement is called to come and intervene. And so the focus of the training that we've had since 2001 has always been about an awareness level of people in crisis and an appreciation of that to the tune of engaging in a manner that doesn't escalate. You know, if you simply take the same rule of medicine of doing no harm, that's our motto, of doing no harm, when we're called to the scene of an incident where somebody's in crisis and they represent no threat to them, to anyone other than themselves. It's those instances where an individual in crisis, whether it's because of some social issue that has developed in their life, some personal news of a loved one's death, a pending divorce, whatever the case may be that's caused them to act outside of the norm, we need to intervene. And as long as they present no threat to anyone other than themselves, our policy is to take as much time as we possibly can to mitigate that problem. This is not a new issue in San Francisco. Chief Heather Fong brought this issue up when she was chief. Chief George Gascon brought it up, now Chief Sir. Because they've all seen instances in which if we had a best practice tool in San Francisco, we could mitigate the need to take a life. Case in point, the most recent incident in July of this year, where an individual who was in a state of crisis, the information the police department received via 911 gave us no light of a history of mental illness. What we had to deal with were these facts. This individual came at a coworker, slicing the coworker's arm, and then proceeded to come at the coworker further.
His sister begged you not to use him as an example in this case. His sister begged you not to use him as an example in this family.
I can rest assured that we train our CIT officers to engage people very respectfully. That's not appropriate. It's the second time you've done that. Appreciate you just sit there and be quiet. In this instance, it simply wasn't a matter of the officers engaging this person for over 10 minutes. 10 minutes, and only until such time as the person went into a populated area did they have to intervene. The officers went so far as unholstering and holstering their weapons, letting them know that they weren't a threat. And it was only when the individual charged at the officer with a knife did a use of force take place. I've spoken to the officers involved. I've reviewed the facts of that case, and I wholeheartedly believe that if those officers were equipped with electronic control weapons, it's likely that person would be alive today and likely on the road to recovery. This weapon system, I've taken a lot of notes relative to some of the comments made by some of the speakers, and I'll speak to them. It is a tragedy that the law enforcement agencies across the country have to be the conduit by which mental health services in some instances are provided. It's a shame that the Los Angeles Sheriff's Department is the largest provider of mental health services in the world. That's a tragic reality. So the reality is our officers in the field are dealing with people in crisis, oftentimes much more frequently than professional mental health providers. That's not something that we can change. What we can change is how we engage them and how we mitigate the need for a use of force. There was a comment relative to veterans, and I'll bring this up. I think it's incredibly important that all officers in our department are aware of the dynamics with veterans. I mean, we're talking about 8 personality type people who are trained in the use of deadly force, and when they're in conflict, that can be a terrible thing. So one of our efforts in our department is simply to recruit veterans who have served our country and who are now police officers in San Francisco. And it's quite simple. A veteran is going to be able to relate to a veteran better than a non-veteran. And hopefully that in itself would help mitigate. Our department has a history of cultural competency training, of community engagement, of mental health training. It was presented that there were only 74 officers trained, as Elena Brooks points out. Over the 10-year period, we had some 983 members of our department trained in a 40-hour block of training in mental health awareness. Since I took the coordinator's position in September 20, 2011, we have trained to date 116 officers in the new model. And the new model is it built upon what we previously did. The new model is about creating, engaging the officers, making certain that they develop the de-escalation skill first and foremost, selecting officers who show a propensity to engage people without the use of force. That's the first and foremost that we want to do. And then secondly, provide them with the training that's going to allow them, hopefully, to de-escalate situations. I often say to my officers, because I don't want them to walk away with the burden of thinking that every single situation is manageable. You're professionals, you know that it's not. United States Department of Justice statistics indicate very clearly that assault against mental health workers and professionals is right up there against assaults against law enforcement officers. Quite simply, words do not always work. And when they don't work, what do we want our officers in the field to do? When they're limited in terms of the equipment that they have to stop a person from being a danger to others. And that's precisely why this conversation has begun again. Chief Sir and myself were truly troubled by the reality that we put our officers in a situation where we do not give them the best tools out there to de-escalate, and they have to live with the reality of taking someone's life. And I offer to you, I've been an officer in this department for 20 years. I don't know a single person who wants to take someone's life. I do not. Our people are good people, and they want to make a difference in people's lives. They want to help them get over the hiccups that these crises create. I offer my words to you. I thank you for your time, and I'll address any questions that you have.